Today's guest is Dr. Mike Van Thielen. He has a quote that I really like. One can only perform at maximum potential when in optimal health. Dr. Mike Van Thielen is a doctor, a keynote speaker, best-selling author, philanthropist, world record-holding pro athlete, among many other things. Dr. Mike Van Thielen is the medical director at ClariGenZ Health, an innovative medical company with a new pill providing all the benefits of Adderall without any of the harmful side effects. He is also a treating physician for Boston Neuro Pain and Psych centers, helping tens of thousands of patients with chronic pain and mental health conditions. Trust me, this is an episode you want to continue listening and watching.
Welcome to Simply Walk the Talk. Our bodies and minds adapt to what we do most of the time. If you want to change your body and mind, you must change what it is you do most of the time. This podcast explores all things health, wellness, fitness, lifestyle, and biohacking. Stay tuned as we explore various thoughts, methods, and experiences from a multitude of conversations between our interesting guests and experts through many fields of work. Sit back, relax, and enjoy the show.
Simply walk the talk. Simply walk the talk.
Dr. Mike Van Thielen, welcome to the show.
Thanks for having me. It's a pleasure.
Yeah, it's really interesting because when doing some of the research and learning more about you and what we're going to talk about today, I couldn't help but notice that you wear many hats. And I was like, I know even Gordon and I were trying to figure out like the best lower thirds to use for you because, we'd have to have like an entire page to list all the things that you do. So with that, I'm excited to kind of learn more about what you know. And I would like to start with your background so that people understand why it is you've done so much and how you've gotten to where you are today.
Yeah, no, of course, a long story, but we'll keep it short. Most people can recognize an accent. I'm originally from Belgium. I grew up there with my brother and my mother. My mother worked really hard to provide for the two of us. And basically, we survived, of course, but I had to be a little bit of an entrepreneur at a young age if I wanted something extra. So I actually, at a young age, I went to flea markets to try sell some stuff I found up upon my grandmother's attic to make a little bit of money. And then I wanted to go to college. Luckily, in Europe, college is not that expensive. So I was doing private swim lessons, teaching swimming to kids. And also, I started to become a DJ to make some money so that I could go to the University of Brussels. Initially, I did physical education, which was a lot of fun because I like sports. But obviously, what are you going to do with that ultimately? So then I proceeded to do physical therapy. And that's when I ended up traveling with the Belgian Olympic swim team in preparation of the Olympic Games in Atlanta in 1996. And then after the Olympic Games in 1996, they apparently were short of physical therapists in the United States. So a recruiter called me up and basically asked me if I wanted to come work in the United States. And I was only in my 20s. So I saved $400, put my jeans on, packed my backpack, and came to live the American dream. And then basically I was exposed not just to conventional medicine, but also what they call or label alternative medicine. And I got really interested in those modalities. So I went back to school to the College of Integrative Medicine in Florida, Orlando, got my license in acupuncture, Doctor of Oriental Medicine, certified in Chinese herbs, homeopathy, and all that kind of stuff. But after another 1,000 patients, I was a little bit disappointed because these alternative therapies are indeed less invasive and less harmful than conventional medicine, meaning drugs, injections, and surgeries. But they really didn't give me the long-lasting results either. So I decided I had to go back to basics. And that's when I decided to get my PhD in holistic nutrition. But I also started looking at animals in the wild and finding out the truths from Mother Nature, because Mother Nature doesn't lie. And by combining that PhD in nutrition and looking at animals in the wild, I really became very confident in helping people regaining control of their health, optimizing health. And today, what we call biohacking, objectively reversing their biological age. And that's why I'm regarded an expert in today. So that's basically a little bit my journey in short on where I am today as a coach mentor, not only helping people with their health, but also their business when it comes to productivity, focus, engagement, or in their personal life.
Beautifully put. And obviously, I think it's obvious, we're going to talk a lot about the productivity, the focus, because I feel like in today's world, we need more of that. We need more awareness around that. And so some of the methods and the products that you promote and that you utilize, we're going to really dive in on that. But before we do that, I couldn't help but notice when I was looking online and doing more research on you, and then even seeing you now, I can't help but notice that you're a very fit guy. And the idea of you being a world record holder comes to mind right now. So can you talk a little bit about that, about, you know, what it is that you did to have a world record?
Yeah, it's also an interesting story for sure, because when I was young, 7, 8, 9 years old, and in elementary school in Belgium, I was the fastest runner of the class. I was on a soccer team, basketball team, but a friend of mine was part of the local swim team. So when it came to swimming, I couldn't win, and apparently I was a sore loser. So I can't really remember, but my mom tells me that my solution to that problem, me not winning, was to actually join the local swim team myself. And that's where I found my passion for swimming. But today I still joke that it's actually my worst sport. But fast forward, I swam from age 8 till about age 24 in Belgium, had several Belgian age group records and national records and titles. And then when I came over here, obviously I stopped swimming. And I took probably about 22-year break. And then at one moment, I was scrolling to Facebook and I saw a Belgian friend of mine who swam a Belgian masters record. I didn't even know what masters were, but basically it's your age groups. So you can compete in the 40 plus, 50 plus, etc. And so at that moment, I said, I got to go back in shape. So I got interested. I looked up some records in Belgium, and I thought to myself, well, in 6 months, I could break this record, this record. And so then it went from breaking 13 Belgian records to looking at the American record and a world record. So then in 2019, I broke a world record in the 45 plus. I was 48 years old. And then I wanted to go to the World Championships a year later to swim more records, but that's when COVID started and everything got postponed. So that's where the story ends. But yes, in 2019, I swam a world record. I think the major difference was because I actually swam faster than I was in my 20s. And in my 20s, I was a good swimmer. But that's where biohacking comes in. That's where upgrading comes in. My endurance obviously wasn't as good as in my 20s, but I'm stronger. I realized you got to work more on technique and strategy and nutrition and visualization and manifesting, which as a 20-year-old you don't care about and you don't do.
Work smarter, not harder, right?
Yes.
Or in your case, maybe a little bit of both. But I find that to be very fascinating in that you claim that it's your worst sport, yet you were like, you know what? Like if I want to be good at it, or if I want to be good at everything, I have to try everything. I have to work at it. So kudos to you on that. And that's very impressive. So well done. Now I'd like to talk about this piece around your holistic nutrition practice. And then obviously I think more and more people start to realize nowadays that the prevalence of ADHD, ADD, a lot of these things have really spiked and have like the trend is going upwards instead of downward. And I'm certain that there's a number of things with our epigenetics, right? So like our environment, what we eat, and things like that. But there was also, in parallel to that, there was this idea of prescription medicine, mainly Ritalin, Adderall, a lot of these things, right? Can you talk a little bit more as to why you started ClariGenZ and what this has done for that world in general?
Yeah, it's a great backstory. I always write books about health and things like that. And then the pandemic started and I had some extra time because I was the CEO of a stem cell clinic and we closed the doors. And now it was time for me to reflect and decide what's next. But during that time, a colleague of mine asked me to help out with pre-screening calls for medical marijuana? I said, sure. So I ended up talking to hundreds of people every week, all of them with anxiety, depression, ADHD, bipolar, worry, fear, PTSD, you name it. And so, yes, there's therapies out there. Yes, there's drugs and supplements out there. But when I really, talk to them and ask them a few more questions, there was a common ground, which people don't talk about. And the common ground really was, there's no purpose in life. There's so many people that live today that go day by day, going with the motions, being bombarded with 14,000 digital messages and unable to organize that chaos in our heads, going through the motions at work, getting bombarded with extra work from the boss, going home, trying to get the kids to soccer, dealing with your partner. And so we never get caught up, and we are, our life is scripted for us. And so the problem with that is, if you don't know what tomorrow brings, literally or financially, and what next week brings, or next month, or next year, obviously, if I put myself in that place, I would be worried, I would be uncertain, which then leads to anxiety, depression, etc. So I find a lot of people are in that situation, but I think if they would just address the underlying cause, meaning finding purpose, having a passion, having fire, pursuing your dreams, and knowing what tomorrow brings, meaning being organized, being in control of your calendar, being in control of your life, creating that clarity and that vision, I think a lot of those mental conditions would simply go away. And so being in that pandemic, or having talked to hundreds of people, I now help people with their purpose, with organizing and controlling their life, with maximizing focus and productivity, freeing up valuable time, etc. But obviously, on the side of that, I noticed that a lot of those people are on these drugs like Adderall, Wellbutrin, Ritalin, etc. And obviously, I never can promote drugs. They have many adverse reactions. In the long term, they never do our body, our mind a favor. And they only should be very temporary solutions, but most people are on them all the time. So at that point, my quest started to look for the natural alternatives, which are called nootropics. So we have smart drugs, which could improve focus and productivity and get those, distractions gone. But then we have the natural alternatives, which are called nootropics. And there's many nootropics that we know of. Of course, caffeine, nicotine, ginkgo biloba. There's many Ayurvedic and herbal medicines that also are considered nootropics. So I was going that route, and I stumbled upon a doctor that worked for Boston Neuro, Pain, and Psych, and he identified, or he discovered a key ingredient which now is being patented as biocitroid. But biocitroid basically is a terpene from a specific type of blood orange or citrus fruit, if you will, from the southeast region of Asia. And biocitroid, or this terpene at 30 milligrams or higher, has been shown to pass the blood-brain barrier. So within 30 minutes, you can feel the effects of biocitroid, while most other supplements you need to build up into your system to hopefully experience a positive effect in a few weeks. So this works pretty quickly. And then I started working with them because we decided we need to add some synergistic compounds to this biocitroid. So we added L-tyrosine, which, as you know, is an amino acid that really helps with memory and recall and things like that. We also added phenylalanine, which is a neuro agent, which again helps with photographic memory, recall, and those types of things. So it's all very synergistic. And then the last one, or the third one that we added, I think is probably the most important one, is phosphatidyl, because phosphatidyl has been shown in research to stimulate NGF, nerve growth factor. So that helps us also recruit more brain cells, form more brain cells, helps us with neurotransmission, etc. So when we put those four ingredients together, we have something that works quickly, that does not have any jittery side effects like caffeine or nicotine, and that doesn't have any long-term side effects. So that's why I started promoting this as an alternative, especially for students and young people, as an alternative. So let's try this to see if it helps you focus, if it helps you with productivity versus being on those harmful drugs. And at the same time, I started to write my last book, which is called the IZOT method, Unleash Your Superpower, which talks about maximizing focus and productivity and freeing up valuable time, because it's not always about supplements or drugs. It's about, let's get organized. Let's implement strategies and tips that would help you eliminate those distractions. Let's educate people about dopamine overload. And if we do that, we can control 90% of that focus and productivity. And maybe we don't need a drug. And maybe we don't need even that nootropic that I'm talking about.
You know, what's interesting is there's a lot of things that come up, and thank you for explaining the ingredients and what they do, because I'm certain that people who are at this point still listening and watching, that's one of the first things people want to know. Okay, what's in it? You know, are there side effects? Is it potentially addictive? I know these are a lot of the normal questions. So you've addressed some of the fact that there's not many side effects. What about the addiction piece? And also, how long should one expect to sustain said results, right? So you mentioned that they should be able to feel it within 30 minutes. How long should they expect that to last? And then, is this something you take once a week? Is it something you take every day? Should you cycle on and off of it?
Yeah, no, great question. So again, yes, it should work within 30, 40 minutes, and then it should last about 6 hours. So when you know, realistically, you only need one a day, unless you're one of those executives that works 24/7, then maybe you need two a day, right? But again, what I would suggest people is not be dependent on anything. This is not something you can get addicted on at all. There's no possible side effects. There's no long-term side effects. Each of those individual ingredients have been proven 100% safe. They just contribute to your overall health and well-being. They happen to be upgrading the mind and have you focus better. And again, it works well for some people, and other people don't seem to respond. So it's always something that I suggest people you try. So for the listeners that want to try a free sample, go to trysmartpill.com, get a free sample. If it works, great. If it doesn't, also. But to answer your other question, is should you keep taking it all the time? I don't think so. I think it's a facilitator when you need it. And while you're using it and it feels it works, you really need to start to learn implementing tips and strategies to increase focus and productivity. You mentioned the Pomodoro technique before we started the podcast. There's many other things that we can do in our environment, and many things that we can do to eliminate those distractions and avoid a dopamine overload. So we can talk about that. But I think, you know, while you're on this nootropic, if it works for you and it gets you into that zone, or your ability to focus better, that's great. But still, we want to try to find techniques and things that work for you and create a power routine that you can count on and basically get you in the zone on demand, because that's what the book is about, getting in the zone on demand. And that may work without a smart drug or a nootropic. And so eventually, I think, to answer your question is, you know, let's design or let's create a power routine that works for you, so you are in the zone and you can produce and you can be focused. And then maybe you want to try this smart drug, this nootropic called Focus Plus, by the way, not necessarily on a daily basis. Eventually, once you get that power routine down, but maybe just before a great speaking engagement where you really want to deliver, or before an important meeting, or before you go compete in any competition. So at that point, it may be that icing on the cake to get you really honed in and really being into the zone. So there's no reason you couldn't use this supplement on a daily basis. But at the same time, I always encourage people to, you know, really create a power routine that you can count on to be productive and be focused.
And in the midst of doing your due diligence and researching this product and getting it out there, have you come across any data that suggests maybe this could affect sleep if taken too late in the day? Have you done anything like that?
Yeah, again, so when you know it's going to be 6 hours, you obviously in the beginning take that into account, right? And we're all more productive in the morning anyways. So if you want to get the job done or work on a project or write a piece of music or do a piece of artwork, it's always better to do it in the morning or during the day, and knowing that it could last up to 6 hours. So, but it's different for everybody. Everybody responds different to caffeine. Everybody responds also different to this nootropic. So it's kind of a little bit of a trial and error in the beginning on an individual level.
Yeah, to that point, I'm glad you just mentioned that, because earlier you mentioned that you were, I guess during the pandemic, you were the medical professional sort of screening everyone for medical cannabis, right?
Mm-hmm.
So I'm a medical cannabis patient, and with me, it's very interesting that you sort of you've mentioned everything so far about Focus Plus and even your book and some of these strategies. I like to use certain strains of cannabis to also get me to that level.
Sure.
I do realize, however, that's not the same for everyone. So you touched on that. In fact, we're all different. So I think we understand that. But what is interesting about Focus Plus, at least enough to get me interested in trying it, is obviously I can't always have cannabis with me, nor do I always want to depend on that anyway. Right. And I like to challenge myself, but like to your point, maybe I want to have a kick-ass podcast like today, I take this product called blue cannatine, which is why my tongue is blue, right?
Methylene
So I'm sure
methylene
blue.
Yeah.
Exactly. So I'm a big fan of nootropics. I'm a big fan of quote unquote smart drugs, because I'm always, I think it's always useful for me to be focused. And one of the things that I say to people sometimes is that I have a slight photographic memory. And when you touched on that, on the Citroid, I think you mentioned, helps to open that up. I'm like, okay, sign me up, because if I can improve upon what I already have, like, sign me up. So
no, it's great, because like you said, medical marijuana works for a lot of people, especially with the anxiety, depression part. And if you have, in other words, you're not just limited to one tool in your bag, and certain tools may be more appropriate at certain situations or when you're traveling, etc.
Exactly. And to your point, I didn't really mention why I use medical cannabis, but for me, it gives me this supreme focus on whatever I decide to do. So if I want to clean my apartment, because let's face it, like a lot of times we tend to push off the things that we don't want to do, but we need to do. And when I get like that, I already know I need to just dose up, or I call it get elevated. And I'm going to probably clean the entire apartment, and maybe even offer to help clean somebody else's.
I mean, you're 100% right. The other thing I think people need to know is they need to know about the dopamine overload, because if you understand why you have a brain fog, why you can't focus, why you are procrastinating, why you're fidgeting, why you can't get the job done, then it's easier to take the measurements to combat or to overcome that. So, we have 5 intelligence hormones, right? Dopamine, epinephrine, norepinephrine, serotonin, and acetylcholine. And if they are in balance and at optimal levels, that's when we're in the zone. That's when we perform at our best. That's when we maximize our focus. Now, what is a dopamine overload? Dopamine overload simply means that dopamine is too high compared to the other 4 intelligence hormones. And so there's an imbalance, and it's that imbalance that causes that brain fog, that procrastination, the inability to focus, no attention span, no productivity, unable to perform. And so that's the cause of it. So if you know the cause of it, we need to then lower that dopamine. And I'm just talking about people that have these symptoms of unable to focus, because there's also ways to increase dopamine. But today in our society, most of us need to lower it. So, the dopamine is caused, obviously, for those that don't know what dopamine is, it's one of those hormones, but it's also called the reward hormone, because when our brain squirts a little dopamine, it feels good. It's like getting a pat on the back. So we crave it, we like it. And so sugary drinks and energy drinks and bad food usually gives us a dopamine squirt, which we like. And then today it's even worse, because now we have this social media. And that's why many of us are addicted to social media, because when somebody comments on our post or hearts our Instagram, it's a dopamine squirt and we like it. So we seek more of it many times unconsciously. So once we understand that the dopamine overload is causing us the inability to focus and be productive, then we can upgrade our diet, reduce the sugary drinks, reduce the energy drinks, and start to take the measures necessary to get in control of our social media so we can balance those hormones and optimize those hormones. And then we can work on those types of things. And a smart drug or a nootropic may be part of that, but many times it's kind of taking control of that social media, taking control of your life, assigning a designated place in your house or the office to work on your projects or to do your homework, letting people know not to disturb you, taking that phone and putting it on airplane mode so you can focus, implementing the Pomodoro technique, which works for some people, not for others, which basically is a technique that says you're going to be focused and work 20, 25 minutes straight, no phone, no distractions, close the door, and then there's a 5-minute break mandatory where you walk away and do something else, and you repeat that cycle 4 or 5 times. So there's many tips, many strategies, many things that you can do to eliminate distractions so you can focus and be productive and get that dopamine in balance with the other intelligence hormones.
That's a perfect segue into our Pomodoro break. So, yeah, Gordon, you're like, yep, he's ready for it. So we do this a lot on the show, and I think you're the perfect guest to go through this. And I know before we started recording, you mentioned that you have some techniques like this in your book. So we'll obviously list this in the description and talk more about it at the end of the show as to the best place you can find out about the book and whatnot. But let's talk about what you do in situations when you've been sitting or standing or just sedentary for long periods of time.
Well, yeah, like now when it's sedentary, you got to get up and move, right? We're designed to move. Movement doesn't necessarily mean exercising or going to the gym. It's actually just moving, whether it's walking or dancing or, running or jogging or whatever it is that you want to do. But we need to move. We're a plumbing system. Our cardiovascular system is a plumbing system. It needs to move. And so is our lymphatic system, which is part of our immune system. So we need to hydrate, drink a lot of water. So during breaks, yes, you need to drink a lot of water so nothing gets clogged up in those plumbing systems. And we need to move. And so we can just move, or you can have a vibration platform or a mini trampoline, but we need to move during the day in order to stay healthy. You can do Tai Chi, you can do any type of movement as long as you're moving. So that will be the best thing to do, is get up, swing those arms, do a few squats, walk outside, hydrate yourself, and get everything moving.
Could you give us a physical example? It doesn't have to be for a long period of time, but I just would love to see something. So for one, this gives...
Yeah, if I stand up, you won't see me anymore. But usually what I would do is I would shift my weight when I stand up from left to right. So I'm rocking, and then I'm going to swing my arms, left and right in rhythm with my legs, rocking left and right. So it ends up being a whole body movement that really gets the heart going a little bit, but involves the core, involves the arms and the legs. And usually 3 minutes would be pretty good to get a good cardiovascular and lymphatic effect.
Beautiful. For those that are curious about more these little techniques, there's a thing that I like called the NO dump, which is a nitric oxide dump. And it's another sort of brief movement. I think I have some video examples of it on my YouTube. And it's something that you could also do. It takes a few minutes. And if you do that a couple times throughout the day, chances are your circulation is going to be a lot better. You're going to suffice that movement, that Pomodoro break, if you will. And I think when you have a plan in place, then everything else kind of works better. And I think it helps with productivity and with focus. So thanks for sharing that. And we'll keep at it.
That's good.
So, okay. You've got this book. You've got ClariGenZ. What else is within what you do, right? Because I know there's so many things, you wear so many hats. What else can we offer for people to kind of say, you know what, I want to find out more about this guy?
Yeah, well, I'm really focused. It was in the past, it was all about health and the body. And then after COVID, when I got through this experience with, mental health, I'm really focusing more on upgrading the mind, right? And with upgrading the mind, there's many aspects. Number one, I really work with people on finding their purpose or confirming their purpose. Because when we're born, we're pushed in a certain direction by society. We got to go to school, then we got to go to college, and when we graduate, we got to work for somebody till we're 65, and then there's the golden years, which usually never come. Or our parents or teacher push us a certain direction. If dad's a lawyer, he probably wants you to go to law school. His mom's a doctor, she probably wants you to go to med school, etc. So many people, they may be successful in what they're doing today, but they may not be living their purpose. And so what I do with people initially is I try to either confirm that they are living their purpose or find their purpose, because we need that fire, we need their passion. A lot of people don't know their superpower. A lot of other people, they know their superpower, but they're barely tapping into it. So what I'm trying to do, today, and as a coach and as a mentor, is have people unleash their superpowers. So first, I really focus on purpose. Once we identify that purpose, we really need to start taking control of that life. And that's what we talked about today. We need to script our life. We need to have a plan, a strategy. We need to surround ourselves with a team, what I call a team of experts, which are not necessarily experts, but these are people that we need to reach our highest potential, people that are strong where we are weak, because we never work on our weaknesses. We need to continue to work our strengths, surround ourselves with people that are strong where we are weak. And so we need to have that plan. What are our dreams? What are our goals? What are the incremental steps we need to take on a daily, weekly, monthly basis? Who are the people that we need? And so when we have that passion and fire, and then we have a team and a plan and a strategy, the next thing that we need that mindset. We need to really work on our belief system that we can be successful, that we can do what other people can do, and that we can realize our dreams. So we need to eliminate false core beliefs. We need to make sure that we have no doubt in our mind that we can reach our goals and our dreams. Because if there's doubt in our mind, then the universe has two options: success or failure. If there's no doubt in our mind that we can reach our goals and our dreams, then the universe only has one option, and that's a big win. So I work with clients, techniques, breath work, visualization, manifestation, eliminating false beliefs, managing or controlling their emotions and feelings. That becomes very important, because the mind not only controls that body, but also creates our future and creates our success. So that's biohacking the mind, or upgrading the mind to that aspect.
I like it. I can't help but at least ask the question, because we have talked about your swimming and the fact that you were doing all kinds of sports growing up. What is your fitness routine, or your sort of your day-to-day look like nowadays when it comes to physical fitness and health?
Yeah, I was beginning of the year, I started swimming again, trying to go for the World Championships in Tokyo coming up next month. But then in February, I really torn both rotator cuffs, and I had some degeneration, inflammation of the AC joint, so I couldn't really swim at that level anymore. But ideally, I actually, on a daily basis, I have 4 power routines. I have a morning power routine, an evening power routine, a dream routine, which is working on your goals and dreams, and then a biohacking routine, which is upgrading the body and the mind. So I have, so ultimately your whole day is nothing but routines, and I divide them up in those 4 power routines. But when it comes to physical activity in the morning, there's that movement. It used to be swimming, but now it could be anything, from going for a bike ride, going for a long walk, grounding on the beach, grounding in the park, or being outside. So movement to me is more important when it comes to being in optimal health. Of course, when you want to swim world records, movement's not enough. You're going to have to really train hard. But training hard, again, is a catabolic activity. It breaks down the body. So in the long run, performing or physical activity at the highest level is not necessarily the best for your health.
I say that a lot. So thank you for sharing that, because I'm not the only one saying this, obviously, because it's what we hope to gain physiologically or performance wise. We're going to get once we recover from said breaking down of the body and the musculature. And so I think it is important. People need to think about that a lot more. And of course, when you're trying to go for world records or you're going for world championships and things like that, you're going to have to push your body much harder than you would otherwise. At the same time, you need to also push your recovery harder.
Exactly. Yes.
So I'm glad you brought that up. And I think it's quite clear that you are a keynote speaker. Just the way that you are communicating with me, you speak very well. Can you talk about some of because I know in some of the research I did on you, I noticed that you shared the stage with some pretty big names. Can you talk about some of those experiences?
Yeah, no, I mean, I love speaking because that's when you obviously share your message with many people, if not hundreds, thousands, or tens of thousands of people. And you just can hope that a small percentage of those start implementing, even if it's just one thing of what you taught them, so it makes a change in their life. And so that's what I'm always excited about. But yes, I've been on the stage with Darren Hardy and Nick Vucevic, Dr. Fatman Sini, Dr. Mercola. So those are, some pretty big figures when it comes to, health, not disease, but health. And so, this year, for example, I've been a keynote speaker at biohacking conferences, the Biohacking Congress. And on August the 12th coming up, I'll do a TED Talk in Denver, Colorado, too. So obviously love speaking and trying to, help people live their purpose and upgrade their body and their minds. And that's why I do podcasts like this, too, because you guys doing a great job is getting those messages out and spending your time. So I'd like to thank you, too, for your time and effort is to get this word out and help as many people as we can with their health, with their mind, with their life, with their purpose, right?
This is my favorite way of learning, to be honest with you. It's like we can read books, we can read articles and medical journals and all of these things, or we can do what we're doing now, which is just talk with one another, right? Have a conversation, let people in on that conversation, and then go out and experience, right? Trial and error, test it out. And this is what biohacking is all about. I feel like, we should be a little bit more open to some of the things, because I think the pandemic really opened the eyes of a lot of people, because it's like, whoa, wait a minute, what's going on? What are we doing? And no matter where you sit on your stance on any of that, I think it did open our eyes. It should have opened our eyes. Now, being that you've been on many podcasts and you've done a lot of keynote speaking, this is a question that might be challenging for you, but what is something you wish people would ask you?
What they would ask me?
Say you've gone through a cool interview. You're like, man, that was really good, but I wish he would have asked me this. What is that?
Dr. Mike, how can I be the best I can be, perform at my highest potential? No matter what I want to achieve, I feel with my experience and, basically when I came here, I told you I came to the United States with $400 in a backpack. I had no mentor or no coach. So needless to say, I got knocked down many times. And my motto quickly became, I never lose, I win or I learn. And so it took me a long time to get where I am. And so now I feel I'm in a position where I actually can show people not a shortcut in Denset, but show them the pitfalls and make them accountable on a daily, weekly, monthly basis and stick with them until they achieve their goals and their dreams. So, when you ask that question, I would love to have people come up to me and, Dr. Mike, can you help me reaching my full potential, unleashing my superpowers, realizing my dreams? Where do I start? Where do I go? What are the steps? That's what my latest book is about, and that's what I love to help people with.
Quick question. You mentioned accountability there, and I think that's really important with all of this about being honest with yourself and accountable to the people you love and around you. I'm curious, how do you help people incentivize them to be more accountable? Like right now, there's a lot of denial and people I think are just not wanting to be honest about a lot of things. Do you have a method you do to help people be more honest with themselves and accountable?
When it's my mentees, obviously I have a strategy. In the beginning, it's about, education about the dopamine overload, but I also educate them about the comfort zone, what the comfort zone is, what to expect when you try to get out of comfort zone and into a new growth zone. So I set up some standard knowledge, some education, a framework in which we can work, if you will. And then they understand why we're taking certain steps. And so we're going to start working on purpose. We're going to start working on getting organized and getting that calendar clear, creating that control, because control creates clarity. Clarity omits all stress, and focusing on those dreams and that passion and that mindset. So once I have that framework and they understand why we're doing certain things, it's much easier for me then to, within that big plan that we have, is set weekly goals, which are incremental small steps toward that big dream. Because we all know that if your dreams are not big enough, or if your dreams are not scary, they're not big enough, right? But if they are scary, then most people think they can't attain them or can't reach them, and they feel overwhelmed. And that's why it's very important, as part of a plan and a strategy, that you break that big goal down in very, very small steps. Maybe our goal is to reach that dream in 7 years from now. So we got to break it down year to year, then month to month, and now week to week. And so what is the step that we take next week? So after a call or a talk with them, I tell them, okay, next week on our call, this is what you need to accomplish. And so I make them accountable on those very small steps, which is great because they can attain and accomplish those things. And therefore there's that fulfillment each and every week. But I make them accountable. I tell them what they need to do, what needs to be done, and I make them accountable and making sure that's done, so we can continue to make those small steps to that big goal and big dream.
One of the things that I really resonate with, and I think is going to stick with me for a while, is something you said earlier. I never lose. I either win or I learn. I think
right.
that is worth reiterating, and I think it's something that we should all consider.
Put it on a
Because
t-shirt.
oh, that's definitely a t-shirt, right? It's like, I never lose. I either win or I learn. So with that, I want to make sure that we were able to talk about enough today, and I would love to have you come back on, because I think it would be important to kind of maybe go through your book a little bit more, because I, like you, have written a book, and I know the amount of work, the investment that goes in that. So I want to make sure to drive as much traffic that way as possible. So please, everyone, make sure and go and check out his book, and we'll talk about that at the very end. But before that, is there anything else that you would like to speak on today before I go into the last questions?
Well, there's many things I could speak on, but since we talked a little bit about that framework, it's that everybody heard about that comfort zone, and over 90, probably 98% of us are living in that comfort zone where we have a job and we're able to manage to pay our bills, etc., and we're content, but we're not living our purpose or our dreams. And today the world needs all of our superpowers, and so more than 90% of us are not unleashing them or tapping into those superpowers. So it's really important for people to study a little bit more about the comfort zone, because the comfort zone, once you leave the comfort zone, you get into the fear zone, and that's what people are afraid of, the fear zone. But from the fear zone, you enter then the learning zone, where you have to learn new skills to then enter the growth zone. And then eventually that new growth zone becomes your new comfort zone. And then you got to get out of that growth zone again, because you got to go up and up and up in order to reach those big dreams and goals. And so, I like to share with people, like, really, every day's passing by. And so it's really time that you step out of your comfort zone. And maybe you need a coach or a mentor to do that successfully. But you need to take that step. The worst thing that can happen is that you step out of it and you need to step back into it for a while. But we really need to step out of the comfort zone. That's when you learn about yourself. That's where you discover yourself. That's where you see possibilities. That's where we can grow. That's where we can learn. That's where we will meet other people that pull us forward and don't hold us back. So that's where you learn about yourself. That's where we upgrade ourselves. And so please make an effort to step out of your comfort zone and see what's out there. That's all.
This is that's one of the main reasons why I like people to at least consider cold plunging or use of sauna, or something as simple as just taking off your shoes, going outside and grounding.
Do some grounding.
Right? Because, our modern day human being is comfortable most of the time. We're inside, we are sheltered from the environment mostly, which also means we're not getting the negative ions from the earth itself, which is what we need, what we all need. Also, our temperature in our home is comfortable all the time, right? Like I noticed as an American, when I travel to Europe, there's many places that don't have air conditioners.
Correct.
And it's like, oh, okay, they're doing something right, you know. And then also, like, the heating systems may not be that great. Like, you might have to literally go out and chop down wood and carry it in, right? Like, this is kind of getting uncomfortable, but it requires movement. And I also, there's another similar thing to your example of getting out of the comfort zone, and then eventually your new growth becomes the comfort zone, right? I love that. It's very similar to the conscious competence feedback loop to me.
Mm-hmm.
And for people who don't know what that is, I wrote about that in my book as well, because it's something that I use for my practice, for my physical fitness practice. When someone thinks they're doing something and I eventually let them know that that's incorrect, or show them that that's incorrect, that begins the conscious competence feedback loop, right?
Yeah.
And that's when it's kind of like, oh, wait a minute. So this whole time I thought I was doing it right, but now I see that I'm not. So now it's conscious, right? It's conscious that it's incorrect. Yes. And then you can turn that eventually into unconscious competence, right? And then it's just kind of this cycle, and then hopefully you're doing new movements which would require more growth. So there's something there, there's some synergy in that.
Yes, it's knowledge and skill. It's another thing. You know, they say to change a habit you need knowledge, skill, and willingness, right? So the knowledge is like understanding you're not doing something right and admitting it to yourself, like, ooh, I know I'm weak here, or I know I'm doing this wrong. Then you got to acquire the skill to change it. And then the third ingredient is the willingness. Are you willing to change it? Is it important to you? And those are the key 3 ingredients to change from a bad habit to a good habit.
Beautiful. Said with a nice smile and everything. I love it. Okay. On the show, as we're wrapping up, I like to ask 2 questions. The first question is a fun one. What are your top 2 pet peeves? What are a couple of things that just drive you crazy? It doesn't have to be about your company or about anything we talked about today. It can be anything, literally. But what are 2 things?
I would think people pointing fingers or making excuses for the lack of results versus taking responsibility themselves. It's always somebody else's fault. I think that's a pet peeve. And then maybe the second one, people being late, you know, or always being late. I know things happen in life, but you have these perpetual people that are always late. And so, you know, it affects other people, and I guess they don't understand it. So it has to do a little bit with selfishness or being considerate of somebody else's time, which is still our most important asset. So I think those would be my 2 pet peeves.
Those are 2 really good ones. And I especially like the your mention about being late, because that's one of those ones where it drives me nuts, because I work very hard to be on time, and obviously life happens and things happen, but when it becomes perpetual, when you become that person, that's when you start to slowly see me drift away.
Yes.
Yeah. Anyway, my last question is, what is something you're most grateful for?
I think most grateful is probably the ability, the fact that I was at different stages in my life surrounded by people that had me think out of the box, or that showed me a life lesson, or most recently show me that how important it is to surround yourself with the right people, because you know, we have big potential inside ourselves, but you cannot achieve your highest potential by yourself. So it's becoming really important to identify the people that you need to reach those goals and dreams. And I've been fortunate and grateful over the last 5-6 years to get those people in my life to be able to accomplish that.
what is before we go, I want to make sure people know how to follow up with you and kind of keep on top of the things that you're putting out. What was the link that you mentioned for people to try the
Yes, the Focus Plus.
Focus Plus.
That is trysmartpill.com.
Trysmartpill.com.
Yes,
and
get a free
that's
sample.
TRY, everyone.
Yes.
Trysmartpill.com. And hopefully you'll be smarter so that you know how to spell try. Anyway, the name of your book again is IZOD?
Yeah, the IZOD method. IZOD stands for In the Zone on Demand, Unleash Your Superpower. So you can find it on Amazon, the IZOD method, or obviously on my website also.
Beautiful. And what is that website for everyone?
The website is biohackingunlimited.com.
Biohackingunlimited.com. And I noticed that you're also on social media. So could you rattle off the social media handles?
Yeah, I'm not a big social media guy. I have them. Some marketing companies in the past put them together for me. I'm very inconsistent on social media, but from the website, you can get to the YouTube channel, Instagram, etc. There's not that much information. I think my website is kind of the place where you can read about the mentorship programs. All my books are there. My Keynote Speaking is there. Right now, if you sign up for my free email, then you can get a free PDF of the latest book. You can schedule a free Zoom call with me to talk about your goals and dreams and see if I can help you. So everything really starts at the website, and from there you can get anywhere. Biohackingunlimited.com.
Beautiful. And the next time we speak, I'd love to hear a little bit more about your experience in stem cells, because when you mentioned your own injuries to your rotator cuffs, one of the first things I thought about is like, oh, I wonder if he's using stem cells on that, and then also any kind of like medical lasers or red light therapy, anything like that.
Yes, all of the above. Yes,
I figured as much. So yeah, so we could talk about that on the next one. Good luck with your healing of your body. Good luck with everything else that you're doing. Thank you for your time. I very much appreciate it. And yeah, until next time, this is Josh.
Gentlemen, thank you. Thank you for having me. And yes, till next time.
Peace.
Simply walk the talk.
Walk the talk, talking facts. Move like me, but I move a little fast. Make my move, here to last. Fasten these seatbelts, I'm coming past. Take care of me, longevity. Hack my biology, better believe. Walking the talk, soul, mind, and body connected. Better come give us a listen.